Screening for diabetic retinopathy is important to prevent needless blindness. In areas where the ophthalmologists are not available, tele-screening for diabetic retinopathy will be very helpful, especially in the rural areas. You can also use tele-screening in diabetic clinics when diabetic patients come for their routine periodical diabetic checkup, and this opportunity can be used for screening their eyes so that the DR changes in these patients can be diagnosed early before loss of vision occurs. ADRES is one software which helps in tele-screening for DR. In this model shown here, a patient is screened in the diabetic clinic by the local technician, takes the fundus photos, loads it up using the ADRES software, and through the internet sends it to the eye hospital, where a retina specialist or a trained grader grades the images, generates a report using ADRES, and sends it back to the diabetic clinic within a period of about 1 hour. Here, a patient is walking into a diabetic clinic, and the local technician would examine the patient's eye before taking the fundus photos. The patient's demographic data is entered in the software with the ADRES, where all the details of the patient is entered and the patient is chosen. Their images are captured using the fundus camera. The captured images are chosen and they are labeled as, depending on the numbers, as A1, A2, A3, A4 for both right eye and left eye. Once these images are saved, then they are uploaded using the same ADRES software, and through the internet is sent to the base hospital. At the base hospital, the ophthalmologist or the trained grader will open up the patient's fundus image again in the ADRES software, and these images are graded. The software helps in grading the images with asking specific questions as to, for each image, hemorrhages are present or hard exudates are present, and the grader has to just answer yes or no based on the image findings. By default, it is a no in all the questions. Based on the input for each of this image, the software will be able to elicit the diagnosis as to whether it is a mild, moderate, or a severe diabetic retinopathy or a proliferative diabetic retinopathy. And this is generated as a report. Here you see the images being graded and the report is generated. The software allows for attaching some of the images with the report, and once the report is generated, the software will also elicit as to the treatment or further management on these patients. This is generated as a report and is sent back to the base hospital or the diabetic clinic, where this report is printed and attached to the diabetic case sheet of the patient, wherein the doctor or the diabetologist will advise the patient on further management.